Welcome, and thank you for taking the time to learn how the Cancer Care for Life benefit works. The program is available through the group health plan for employees and their covered dependents with a cancer diagnosis. It provides members with education, guidance, and care coordination while helping employers manage cancer-related costs through informed, evidence-based treatment decisions. Participation is voluntary and confidential. Cancer Care for Life is part of Interlink Health, an organization with more than 30 years of experience supporting employers with some of the most complex and high-cost areas of healthcare, including cancer, transplants, and gene and cell therapies. 14 years ago, this work led to the launch of Cancer Care for Life, a dedicated cancer solution designed to help members navigate the clinical, emotional, and administrative challenges that can arise during a cancer diagnosis. Today, this approach serves more than 2,900 employer groups nationwide and reaches more than 1 million people. A cancer diagnosis can be complex and unpredictable. For employees, it often brings questions, stress, and uncertainty. For employers and benefit plans, it can also create meaningful cost and care complexity. Managing these challenges at the same time, supporting employees in a consistent, meaningful way while maintaining responsible oversight of the health plan can be difficult. Cancer Care for Life is designed to help address these issues by providing structured guidance across diagnosis, treatment, and survivorship, including prevention awareness and coordinated clinical support. Through the program, members have access to oncology nurse expertise and educational resources that help reduce confusion and support informed care decisions, while also helping employers take a more responsible approach to benefit management. Cancer Care for Life is supported by an experienced clinical team that includes oncology nurse specialists, certified case managers, and oncology-trained registered nurses. Members have access to a 24/7 nurse support phone line, allowing them to get trusted information when questions come up, including outside of regular provider office hours. An important part of the program is helping ensure that diagnosis and staging information is as clear and accurate as possible, since early details can shape treatment decisions. When appropriate, Cancer Care for Life supports clinical review and access to nationally recognized centers of excellence to help confirm key information and guide next steps. In many cases, this can be done without members needing to travel, allowing expert review while they remain close to home and connected to their local care team. Together, this approach supports the program's primary goal, providing patient-centered, personalized guidance for individuals impacted by cancer. Cancer Care for Life is a comprehensive program that supports employees before, during, and after cancer treatment. Engagement can begin with prevention and early detection education, helping employees understand screening guidelines and cancer risk awareness. After a diagnosis, the program provides guidance as treatment decisions are being considered. Employees can receive help understanding care options, available resources, and what questions to ask as they move forward. Throughout treatment, employees have access to oncology nurse expertise, healthcare navigation, and case management. This guidance can help with a wide range of needs, such as understanding appointments, medications, possible side effects, and next steps, along with other questions that may come up along the way. When appropriate, engagement may also include coordination with centers of excellence or information about clinical trials, helping employees understand specialized care options that may be available. Cancer Care for Life continues engagement through survivorship, including support after treatment ends and during return to work transitions. This flexible approach allows employees to connect with the program in a way that aligns with where they are and how their needs may change over time. Getting started with Cancer Care for Life is simple and flexible. After a cancer diagnosis, members can start registration on their own by calling the support line, emailing Cancer Care for Life, or completing a short form on the program website. Participation in the program is optional, and members decide whether and when to engage. If they choose, members may also authorize a caregiver to speak with Cancer Care for Life on their behalf. Employer or broker teams may also submit member referrals. They can use the same options available to members or securely email a referral to the group's client success manager, who will share it with the Cancer Care for Life intake team to help begin the registration process. In some cases, referrals may also come from third-party administrators or care management partners when those services are part of the employer's health plan setup. As part of registration, the member typically has a brief call, usually about 10 minutes, with an intake coordinator. During this call, the coordinator explains what happens next and collects some basic information to begin the registration process. The member may also be asked to complete a form that allows Cancer Care for Life to communicate with their doctor and review relevant medical information. Once registration is complete, the member may choose to speak with a triage nurse right away or wait to connect with the oncology nurse assigned to their case after records are reviewed. After a nurse is assigned, that nurse typically stays with the member as their primary point of contact, unless a change is needed based on the complexity or level of care. After members register, we review their medical records. Then, members are placed into one of 3 risk groups based on cancer type and stage: low risk, intermediate risk, or high risk. Program access is supported through an administrative fee, which covers care management, education, navigation, routine check-ins, and survivorship support for all members, regardless of risk level. For members in the high-risk group, complex case management is provided to support more intensive care needs. Complex case management is billed separately from the administrative fee in accordance with the employer group's agreement. This approach helps ensure that members with the most complex clinical situations receive additional time and coordination, while all members continue to have access to the same core support and resources. Members are reassessed as their clinical situation changes. When it is clinically appropriate, such as when treatment stabilizes or a member completes treatment, the member may move to a lower risk level, including survivorship. After treatment ends, members may transition into the survivorship program, which provides access to clinical guidance and resources as they focus on recovery and follow-up care. Once the assessment is complete, we begin the care coordination process. Each member is connected with an oncology nurse dedicated to their case. The first conversation with that nurse typically lasts about 45 minutes to 1 hour. During this time, the nurse focuses on learning about the member's concerns, support system, and what types of guidance and resources may be helpful. As part of their clinical review, nurses reference licensed clinical tools such as National Comprehensive Cancer Network, or NCCN, guidelines, which are widely used, evidence-based standards for cancer care. This helps ensure discussions are grounded in up-to-date clinical information and consistent best practice guidance. When appropriate, nurses may help members understand whether genetic testing, second opinions, or other considerations could be part of a conversation with their care team. Medication safety is also an important focus. Cancer treatment plans can be complex, especially when members have other health conditions or take multiple medications. Nurses review medications and may flag questions or concerns, such as side effects or treatment setting options, to discuss with the member or their provider. Some members may not feel ready to engage right away, especially after a new diagnosis. In those cases, nurses may still review available treatment plans and medications and work with the provider to offer clinical oversight and support. When members choose to engage directly or designate a caregiver to communicate on their behalf, nurses may also connect them with additional resources. This may include assistance with transportation options, financial support programs, organizing appointments, emotional support, and education about the diagnosis, treatment, and health plan benefits. The goal of this nurse-led approach is to help reduce obstacles so members can stay focused on their health. Members learn about Cancer Care for Life through a variety of communication and education resources designed to support consistent, ongoing messaging. We provide ready-to-use member education materials, including flyers, posters, brochures, and registration cards for member enrollment. We also offer Cancer Awareness Month content, including short messages and articles. HR teams can use this content in benefit newsletters or share it during company meetings. These materials are available in our virtual resource library, so HR teams can access them at any time. The library includes materials in both English and Spanish, and materials can be printed as needed. Please let your client success manager know who on your team, such as HR or marketing, should have access to the virtual resource library, and if you would like any physical materials sent. We offer virtual member education sessions, including Lunch and Learns. These sessions explain the benefit in plain language and help employees understand how to get started. If there is a specific type of message or material you need that is not already available in the virtual resource library, our team can help draft content that fits your communication style. The goal is to build awareness early and keep messaging consistent over time. Along the way, you will have visibility into how the program is being used through regular reporting. The examples shown here highlight some of the types of information included in program reporting. Cancer Care for Life uses ShareFile, a secure online portal to share reports and important documents. Individuals with access receive email notifications when new files are added, so information can be reviewed as it becomes available. Through ShareFile, you may receive notifications about key case milestones, such as when a case begins, is reviewed, or concludes. For members receiving complex case management due to higher clinical risk, approximately monthly case-level reporting is shared through the portal. In addition, summary reports are provided on a quarterly basis. These reports include utilization trends, program impact, and savings captured over time. Quarterly summaries do not include protected health information, which allows them to be shared more broadly within the organization when needed. Because case level and complex case management reports include protected health information, we ask that you confirm which individuals on your team should have access to ShareFile. This helps ensure information is shared only with those approved to view PHI. Cancer Care for Life is available as a resource for employees enrolled in the health plan and their covered dependents who are newly diagnosed, currently in treatment, or post-treatment. As needs change over time, members can contact their assigned nurse with questions or to receive additional guidance. If a member or covered dependent needs assistance, the referral and contact information on the screen can be used to connect them directly with Cancer Care for Life. For employer groups, questions about the program or account-related topics can be directed to the shared account management email shown here, which reaches the full client success management team. Thank you for taking the time to learn more about Cancer Care for Life.